Hello, everyone. Welcome to the Flint Community Webinar, your community resource every Friday at noon. We are so excited to bring the expertise we have here today. We've got a huge panel and a bunch of really important expertise. We've got Nurse T and Dr. Gordon here, Dr. Ryan Reese out of Hurley, who's going to talk to us a little bit about CPR and what we can do when we need to perform CPR in the community. We've got Jim Malinowski and Misty Davis here to talk about Social Security and disability and dental therapy and how we can improve oral health equity. A bunch of people here to give you really great resources here today. So let's get started. All right. I think we are starting with Dr. Reese, who is going to talk to us a little bit about empowering the community to improve cardiac arrest survival. Thanks, Dr. Reese.
Good afternoon, everybody. Yeah, we're going to start off on some I'm talking about cardiac arrest. It's a passion of mine for sure to talk about, and in an area of interest, and so I thank you for letting me come on to the webinar to talk to you guys today about cardiac arrest.
We appreciate you.
So just one disclosure, I had some funding from Blue Cross Blue Shield of Michigan Foundation, and an acknowledgement to my collaborators at the University of Michigan, Save My Heart, which is a collaborative project in the state of Michigan to improve cardiac arrest survival, the CARES Cardiac Arrest Registry, and to our local EMS agencies and hospital partners who gave me permission to use their data. And so I'm going to talk a little bit first about the power of data and the power of information in terms of cardiac arrest. A couple of years ago, when I started working in Genesee County, I noticed that there was is a significant disparity in cardiac arrest outcome in terms of survival with being neurologically intact. And so the question came to mind, well, is there a way to track this? Is there a way to identify barriers or areas of improvement? And there is. And there is a nationwide cardiac arrest registry called the CARES Registry, which is Cardiac Arrest Registry to Enhance Survival, which Genesee County uses, the 3 hospitals participate in, and our EMS agencies participate in. And so the data I'm going to show you is from 2017 through 2021. There's a little bit of a lag as it takes time to get all this data put in and kind of verified. So we don't have 2022 quite yet, but just going to talk about some numbers, and then we'll talk about CPR and kind of some things that we can do as a community to improve our survival rate. So something that's been shown to be helpful in terms of cardiac arrest survival is witnessing, having someone witness a cardiac arrest, being right there when that happens is key. And you can see that Genesee County is not quite there in terms of recognizing cardiac arrest when compared to the state and nationwide. So improving witnessed arrest is one area which we'll circle back to. Bystander CPR. So, anybody can do CPR. And so once again, this kind of shows that Genesee County, it's another area of improvement from the last couple of years in terms of increasing bystander CPR. So witnessing it's one aspect, but then doing something about it. So bystander CPR, bystander AED. So I'm sure we've all been to the grocery store or been to the mall, and you see an AED or a box on the wall with usually like a heart and like a lightning bolt through it. And that's a automatic external defibrillator. So if you were in a lethal arrhythmia, this device would be applied to you to shock you out of that arrhythmia. So bystander, so anybody can apply an AED. And as we see here, this is a very big area for Genesee County to improve in terms of application and using an AED when compared to our Michigan and national benchmarks. And then kind of going with that, and what's interesting is that cardiac arrest survival with preserved neurologic function, meaning, basically back to normal, back to your normal self, able to communicate, able to perform your, daily function, able to get yourself dressed, able to, go to work, things like that. And when we look at folks that survive overall from cardiac arrest in Genesee County compared to Michigan and nationally, we're kind of in the same ballpark. And so I think a reach goal for me would be to improve our survival rate in Genesee County. When we look at bystander CPR AED application rate being kind of low compared to Michigan and nationwide, I think if we improve those rates,
Okay. All right.
sorry, we'd be able to further improve our survival rate in Genesee County. And I wanted to spend a couple minutes talking about and debunking some myths surrounding cardiac arrest and CPR and AED. The first one being harming somebody doing CPR. But let me back up a little bit and recognizing, let me talk about recognition of cardiac arrest. So as I alluded to, it's difficult for bystanders or anybody to recognize somebody's in cardiac arrest. And really the best evidence out there is keeping it simple, and the mnemonic or the message that's out there is no, no, go. So no meaning, are they awake? Can you wake them up? Are they aroused? Can you wake them up to voice, to shaking them? Are they breathing normally? So if they're like gasping for air, or they're not really breathing that well, that they're not awake and they're not breathing normally, that may be someone in cardiac arrest. And that's somebody that you should probably do CPR and get 911 and AED and all that. And so, but going to the myth, the debunking myths part, if you're not sure and they're not awake and they're not breathing normally, you're not going to hurt them doing CPR. If anything, you're going to improve the situation, right? If they're actually in cardiac arrest, and you didn't do CPR, they are for sure not going to survive that event. Now, if they didn't need CPR, if they're, they're a really heavy sleeper, and you did CPR, you're not going to hurt them. But when you compare to somebody who should get CPR and you didn't do it, to somebody who shouldn't get CPR and you did, you for sure need to do CPR on someone you think needs cardiac arrest. So you're not going to harm somebody doing CPR. Especially if it's all in, good faith effort. You thought they were in cardiac arrest, you thought they were dead. Probably a good idea to do CPR. Harming from AED. The AED has a built-in computer. It's pretty simple to use. You apply the pads to their chest as the picture on the pads tell you to do. You turn it on and you follow the instructions. And if the device says it needs to provide electricity or shock them, then that is part of the built-in system. You're not going to harm them, right? This is part of that. You want to provide early high-quality CPR and AED application. Another myth that is kind of controversial is like needing a certification to do these things. I think some people think, or when they see an AED on the wall, out in public at the mall or whatever, that they need some sort of card with them to open the box and get it out and apply it to somebody who needs it. And really going back to the beginning, empowering the community to improve cardiac arrest survival. This is one of those things, right? Like, you should feel empowered. If you think someone needs help, we should be in the position to help them. And of course, having some sort of training or background for sure would lower that barrier to help somebody. But if you think someone needs CPR, putting hands on the chest, pumping hard and fast, getting 911 help, getting the AED applied is key to their survival. And so this is a call to action. Let me move my my video bar out of the way. Call to action, right? So recognizing cardiac arrest, we're not relying on checking a pulse, right? If they're awake, are they awake and are they breathing normally? No, go start CPR, call 911, get help. Send someone to go get an AED if there's one nearby, get the pads on, continue CPR. supplied a couple QR codes to some training or some demonstrations that I've done in the community. The first one being through the hospital, through Hurley Medical Center, and a hands-only CPR demonstration. And the second one, I was invited to ABC 12 and talk with Matt Barber about hands-only CPR. I don't know if anyone's seen it, but he ends up breaking the table. he was so vigorous with the CPR, he breaks the table. But this is one of those things, call to action. If you recognize, recognizing cardiac arrest and doing something about it. Thank you for listening, and thank you for inviting me. Are there any questions out there?
I really appreciated, Dr. Reese, you sort of explaining some of the myths, because there's so many things we don't know, and there's different mnemonics, ABC, like, what should we start with first? What's the biggest piece of advice? And you gave some pieces of advice, but what's the biggest piece of advice you would want a community member to walk away with when they think about providing CPR to someone who they think needs it?
Yeah, I mean, so the biggest thing, and once again, we're talking about ways to improve the ability of someone to do that. And so, you're not putting lips on a stranger. You're not doing mouth to mouth. It's literally hands in the center of the chest, pumping hard and fast. And then there's some songs out there. I mean, I alluded to it in my slide, Staying Alive by the Bee Gees is a tempo to do the CPR to. But the biggest thing is that we as a community have the ability to affect change, and we as bystanders, can really impact long-term survival in somebody. And we've seen a lot of these events, some of these well-televised sporting events, or well-documented sporting events, that early high-quality CPR AED application can really make a difference and improve someone's chances of really walking away from that pretty scary event.
Yeah. I think that is so important, right? That you actually you are likely to potentially change an outcome in someone who, if they needed CPR, you were able to provide it. It is really evidence-based, and I really appreciated everything you had to say and the expertise you brought today. Thank you so much.
Thank you.
And thank you for all you do for our students. I would be remiss if I didn't shout out Dr. Reese. Dr. Reese is one of our amazing ER docs. He works with our CHM medical students all the time. They adore him. He's such a great resource in the community. He's providing so many different resources for the community, so we appreciate you.
Thank you.
Oh, Dr. Nurse T in the chat says she's got some seniors there asking what happens if they don't do it right.
Well, that's a great question. What's that?
If they don't get the count right.
They don't get the count right. Well, I mean, doing something is better than nothing at all, right? So, someone's job might be keeping tempo, right? Someone, it'd be kind of difficult to remember to sing a song, right? Probably not during an actual event, but kind of keeping track or keeping tempo. Some areas around the country, when you're calling 911, have like a metronome or have someone counting with you. The dispatcher will count with you to make sure you have that that tempo or that beat right. And yeah, so it's better to do something than nothing at all. So if you're not quite 100% on tempo, it's probably okay. Doing something is more important than getting it right.
Absolutely. And then last question in the chat here is, will the defibrillator tell you what to do?
Yes, the automatic external. So an AED, if you go to any, this is something that I do, right? You look for an AED wherever you go, because you never know if you're going to need it.
Absolutely.
But when you turn it on, it tells you what to do. It walks you through all the instructions, apply the pads, stop doing CPR, start doing CPR. It walks you through everything. And I would recommend, it's difficult to kind of get that through a webinar type setting, but I would recommend you kind of, go on YouTube, go on the Google machine and kind of look up an AED, and kind of, there's plenty of resources out there about what the AED will and won't do for you.
Thank you, Dr. Reese. We super appreciate your expertise. And they brought Hillary out. Hillary, thank you so much for being here with us today. And I missed you on when I was calling out people. Thank you so much for being here to talk a little bit about Social Security, disability insurance, and what our community members need to know. Really appreciate your time and your expertise here today.
Thank you so much for having me. I'm going to share my screen because I have some slides to show all of you. It makes it a little bit easier instead of me just talking about it. Okay, so I'm going to be talking about the disability programs that we have available through Social Security. And we have two disability programs. We have Social Security Disability Insurance, which is known as the SSDI program. And then we also have Supplemental Security Income, which is known as the SSI program. So individuals that are entitled to Social Security Disability Insurance, or SSDI, they are entitled to Medicare. And then individuals that are entitled to Supplemental Security Income, or the SSI program, they are entitled to Medicaid. And you can see with the two circles there, they overlap a little bit because there are instances where individuals could qualify for both SSDI and SSI and then have Medicare coverage plus Medicaid coverage. And I'm going to break down each program a little bit, discuss them separately. The one thing, though, that both of these programs have in common is meeting Social Security's definition of disability. And Social Security's definition of disability is having a medical condition or combination of impairments preventing substantial gainful activity for at least 12 months or expected to result in death. When that determination is made, we are also considering age, education, and work experience. When we talk about substantial gainful activity, it's really based on a dollar amount, and this amount typically changes every year. So these amounts on the screen are the 2023 substantial gainful activity amounts. And so for this year, if the impairment is anything other than blindness, earnings averaging over $1,470 a month generally demonstrates SGA. And then blind SGA is $2,460 per month. How this would come into play when someone is filing for Social Security disability or for supplemental security income is, let's say they're filing for benefits and maybe they have been diagnosed with a medical condition like a terminal illness. So we know that they are, they meet that medical piece of the definition. They have a medical condition that is expected to last 12 months or longer or result in death. However, if they're still working and making over $1,470 per month in their gross wages, they would not qualify for Social Security disability or SSI because they're making over that SGA amount. So Social Security disability, it provides a monthly benefit to people who are no longer able to work because of a significant disabling condition. Social Security does not pay partial or temporary disability benefits. The Social Security disability benefit that a person receives, it's different for everyone. And that benefit amount is based on how much a person has worked and paid into Social Security. So who is it for? So it's for people who cannot perform at the SGA level. They may qualify if they have a medical condition expected to last at least 12 months or result in death. If they are younger than their full retirement age and earn less than the SGA amount, and then have recent work in a certain number of work credits based on age. So you may have heard people say, are you insured for disability? Do you have enough work credits for Social Security disability? That's some of the lingo that we throw around. And to find out if you could qualify for Social Security disability or if you have enough work credits for Social Security disability, you can actually do that online. But also when you file an application, Social Security will let you know whether or not you have enough work credits or if you're insured for Social Security disability. So the other type of benefit that we have is the SSI program, Supplemental Security Income. And work history is not a qualifying factor for the SSI program. This is a federal program that provides monthly payments to people who have limited income and resources. So it is for individuals that are age 65 or older, or for individuals of any age, including children who are blind or have disabilities and have limited income and resources. The maximum monthly benefit that we pay, again, this is one of those numbers that typically changes every year. So these are the 2023 amounts. So somebody receiving SSI, the maximum monthly benefit that we pay for an individual is $914 per month. And for a couple, that amount is $1,370 per month. Now, because it's a needs-based program, any other income, assets, and living arrangements can impact that monthly benefit amount. Again, SSI is the needs-based program. Individuals receiving SSI are entitled to Medicaid. Work is not a qualifying factor in order to be eligible for SSI because it's needs-based. So how you apply for disability benefits and also SSI benefits is you can apply online at ssa.gov/disability. As you move through the application process, one of the questions that we will ask in that online application, we will ask if you want to file for SSI as well. And as long as you answer that question, yes, then all of the questions for the SSI application will be generated as well. So when you apply for Social Security disability, it's also an application for SSI, as long as you tell us that you want to file for SSI as well. If you do not want to file for benefits online, that's totally okay. You can call our 800 number. And that's the 1-800-772-1213. We have representatives available 8 a.m. to 7 p.m. Monday through Friday, and they can make an appointment for you with your local office. So they're going to ask you for your zip code, and that will provide them the calendar for the local Social Security office, and they will be able to schedule an appointment for you. You have a choice as to whether you want the appointment to be done over the telephone, or you can go into the office for a face-to-face appointment as well. So when it comes to applying for Social Security disability benefits online, you can apply online if you are age 18 or older and not currently receiving benefits on your own record, and then also having a medical condition that is expected to last the 12 months or result in death. So you have to, meet Social Security's definition of disability, have to be disabled. And then also to file online, you cannot have been denied disability benefits in the last 60 days. And the reason for that last bullet point there is because when someone does apply for disability or SSI, if they are denied, they have the right to file an appeal, and they have to file that appeal within 60 days. So if you try to start a new application, we would say, wait, are you, you're still within your appeal period. You don't have to file the appeal. You could file a new application. You just couldn't do it online. I also want to point out that the first bullet point here talks about that you have to be age 18 or older to apply online. For children, children can apply for SSI benefits. However, that application is not available online. So you would want to contact your local office utilizing that 800 number to schedule an appointment to do so. When you go to our website, which has been redesigned recently, so it looks a little bit different if you haven't been there in a while, where that red circle is, that's where you're going to go to apply for benefits. And once you go to the second page here, it's going to ask you what type of benefit that you want to apply for. So if you're an adult and you want to apply for Social Security disability and SSI benefits, you're still going to select disability. If you select something under that SSI, the two check marks here under SSI, it's just going to take you to another page where you're going to enter in some basic information saying that you want to apply for SSI. So it doesn't create an appointment or anything. It just alerts the local field office that we need to reach out to you to schedule that appointment, but it's not an actual application because the SSI application is part of that disability application. So if you're going to file online and you're over 18, you want to select disability, and that will take you to the application page. One of the very first questions that we ask is who is completing this application, and there's two options. Either I am applying for myself, or I am helping someone who is not with me and therefore cannot sign the application at this time. So if you are applying for yourself, you're definitely going to select that first one. But if you are someone, maybe an advocate in the community or a healthcare professional, and you're helping someone apply and they're with you, you still want to select, I am applying for myself. And by doing this, this is going to allow the individual to electronically sign the application. So it just makes the process a little bit more streamlined. If the person is not with you, that's okay. You can still complete the application for them, but at the end of the application, you're going to have to print it out. They're going to have to sign the application and then mail it to their local Social Security office. So if you're able to sign electronically, it just streamlines that application process a little bit more. So next, I'm going to talk about a Social Security account, creating a My Social Security account. You can do this at ssa.gov/myaccount. You do not have to have a My Social Security account to apply for Social Security, disability, or SSI benefits. However, there are some really great features available in the account. So once you are already receiving benefits and you have a My Social Security account, you can make changes. So you can update your address, your phone number. If you were to start working, you can report your wages through your My Social Security account. You can request a replacement Social Security card through that account. There really is a lot that you can do through that account. And to do that, again, you go to our website at ssa.gov/myaccount. If you already have an account, you just put in your username or password. If not, you are going to be directed to login.gov because we need to verify your identity. So you will be directed to login.gov. You're just going to follow the prompts. It's going to redirect you back into Social Security, where you're going to create that username and password, and then you will have your Social Security account. Another great feature available is when you apply for benefits, if you have a My Social Security account, you can actually check the status of your application through your account. And just a reminder that, you know, you can create an account for yourself. You have to have your own email address, and you have to be able to answer questions about yourself to create the account. You also have to be over age 18, have a Social Security number, a US mailing address, and then also that email address. If you are assisting someone with creating their My Social Security account, you can certainly do that, but that person has to be with you. They have to have their own email address and be able to answer questions about themselves. You cannot create an account for someone else. So you can definitely help someone create that account. You just can't do it for someone else.
Hillary, we had a question in the chat about resources for disabled veterans. Do you have any thoughts on that?
So when it comes to veterans, one thing that well, a couple of things that I want to say to that is, you know, when veterans are receiving benefits from the VA, like disability benefits through the VA, they can still receive Social Security disability benefits as well. So you can receive both. But just because a person receives benefits through the VA based on disability, it doesn't mean they automatically qualify for Social Security disability. So you still have to file an application with Social Security. The application process is pretty much the same. You can file online, or you can contact the Social Security office using that 800 number, or the local office to schedule an appointment to file for benefits. If you were to go to our website, ssa.gov, we have a search box at the top. And if you were to just put in veterans, a lot of information would come up about Social Security in the services that we offer for veterans, but the disability filing process, it's the same for veterans versus non-veterans.
That's fantastic. This has been such helpful information. The other comment was in the chat, is someone wanted your slides. And I don't know if you have a place on SSA where a lot of this information is just sort of as succinctly as you described it available for people to access, or if you have another resource for people.
So all of the information that I talked about is available on our website. We have a really wonderful FAQ page, so frequently asked questions page. Even when people ask me questions and I'm responding to those questions, I usually pull the information and copy and paste it right off of our frequently asked questions page. But any topic that you want to know about, whether it's getting a replacement Social Security card to filing for disability benefits, retirement benefits, if you use that search option at the top of our website, the ssa.gov website, you can put in any sort of keyword and there's going to be a lot of great information that comes up. But again, that frequently asked questions page has good information that's easy to understand, and that would probably be the best place to go.
You know, Dr. Reese did said something interesting. He was talking about myths related to CPR, and I wonder if there are any myths that you want to dispel about the process for applying for disability.
So that's a great question, and I would say one of the biggest myths that is out there is a lot of people think that everyone gets denied the first time that they apply for Social Security disability or SSI benefits. And that's just simply not true. Not everybody gets denied the first time that they apply. Do people get denied the first time? Certainly, but not everybody does.
And I asked that question because I think about people who come to my office and sometimes there is that conversation. Oh, it's going to be really hard. There's not any resources to help. And I think you being on here is such a valuable resource to help people understand that, you know, there's the website, there are these resources for you as you think about trying to access Social Security disability benefits. I really appreciate your expertise and your time. Any last comments that you want to share with people before you go?
Nope, no last comments other than, you know, the starting point I think is going to our website, but we know not everyone, you know, is comfortable with filing for benefits online. So scheduling an appointment is definitely the way to go if you're going to file for benefits. A lot of times, you know, the local Social Security offices, they're pretty busy. So if you go into your local office and say, I'm here to file for disability benefits, you might have to wait an hour to talk to someone. And then when you go back to their window and say, I'm here to file for benefits, they're going to schedule an appointment for you. So I highly, highly recommend calling that 800 number to schedule that appointment versus just going into the office.
Sure. This is such valuable information. Super appreciate you. Thank you, Hillary. Appreciate your time.
Thank you.
All right. I see Misty Davis, and I think we've got Jim, and we've got a bunch of people with expertise today. Thank you so much, Misty. I know you're going to talk to us a little bit about dental therapy and how we can improve oral health equity in Michigan. Super appreciate your time and expertise.
Thank you, Jennifer. Thank you so much for having us on. Really excited to be here and share with the audience about dental therapy, kind of Michigan's oral health landscape, and how dental therapy can fit into that. And before we get into what dental therapy is, I'd like to just explain a little bit about what my organization is, what we do. And so I work for the Michigan Primary Care Association. We are a nonprofit organization, and we're here to really support all of Michigan's community health centers and work together toward a healthcare system that provides equitable and just healthcare for everyone. Community health centers are also known as FQHCs. You might have heard that term, or federally qualified health centers. We usually just refer to them as health centers, so that's what I'll call them from now. But health centers, they're nonprofit organizations as well. They're nonprofit healthcare clinics that receive government funding to exist within medically underserved or under-resourced communities. And so Michigan has about 40 health centers, and we also have 4 Native American health service providers that are members of MPCA. So some of these entities are in rural areas, some are in cities, but all of them include a range of services, usually including medical, dental, behavioral health, pharmacy, and then there's other programs too that that various health centers have. But because the services are co-located all within the same organization, they can do a really great job of providing whole person care, really high quality, comprehensive care to their patients. I just want to give a shout out for the audience because we have a health center within Genesee County area. Hamilton Community Health Network is an amazing organization. They're one of our community health centers. They have 8 locations throughout the region. They have a range of primary and specialty services, just a really amazing team there. So check them out. So the other part about health centers is that they provide care to everyone, regardless of who they are, where they're from, what language they speak, or their ability to pay. So a large portion of their patient base has either public insurance, Medicaid insurance, or no insurance at all. And so health centers really close care gaps for a lot of marginalized communities that face significant barriers to care. So isolated rural communities, low and no income communities, migrant communities, et cetera. So that's a little bit about kind of the mission and purpose of health centers. And so my role within MPCA is to support health center dental teams. I'm an oral health program manager and a dental hygienist. So the biggest challenge right now within our dental teams is workforce. And that's a common trend, I know, throughout pretty much every industry that exists out there, but it's particularly dire in healthcare, and especially within the public health setting. So within health centers, we have a limited dental workforce that's caring for a large portion of our population. And this population often has just more complex and greater oral health needs than maybe some other communities. So health center dentists are just really spinning their wheels trying to provide care, but the care that they're able to provide with the workforce they have is lower in their scope. So things like fillings and extractions, things that nobody else can do besides dentists, but they're not able to provide higher in their scope services to their patients like root canals and crowns because they're just having to focus on that basic care. So the other thing is that the communities that health centers serve really have a lot of barriers to care that other communities might not. So transportation issues, jobs that don't provide paid time off, not having affordable and reliable childcare. So health centers can overcome some of those barriers by providing care outside the clinic setting. So they partner with a lot of community organizations to provide care out in the community where people live and work and play and learn. And so they can use mobile dental equipment and other innovative models. So now we'll talk a little about dental therapy. Dental therapy is a brand new profession in Michigan. And we really see it as a tool that can help address some of these issues that we just talked about. Dental therapists are highly trained, licensed oral healthcare providers. We don't have any in Michigan yet. It's so new that we are just now developing education programs and really starting to look at training dental therapists to come and practice, but we do have rules and regulations and licensure available now. So dental therapists are going to be able to provide some of the things that a dental hygienist can do, so like cleaning, sealants, and fluoride, and then also some of those less technique sensitive things that a dentist can do, like fillings and removing baby teeth. So they're kind of, if you think about it in the medical field, kind of like a PA or a nurse practitioner within the medical setting. While dentist scope includes about 500 procedures, dental therapists can do about 50. So their schooling is much shorter than a dentist. But importantly, their education has to meet the same exact standards for the procedures that dentists and dental therapists both learn to do. So in fact, they actually take the same exact board exam when they graduate as dental students do for the procedures that they're both trained to do. So the quality of education is there. It's just much shorter and much more, I guess, smaller scope. So dental therapists do work under the supervision of dentists, but not exactly in the same way as a dental hygienist or a dental assistant would. Their relationship, again, is much more like a PA or a nurse practitioner. So they can practice remotely. The dentist doesn't have to be on the premises. They can really expand where they provide services by reaching care out into communities and away from the four walls of the clinic. So they can set up in schools and nursing homes and hospitals and other community settings to provide care and really reduce those barriers. So we at MPCA really see dental therapy as a way to strengthen the dental workforce in a couple ways. One way is really baked into the laws around where dental therapists can work. So they have to practice within underserved regions and communities. So there's going to be a much more equitable distribution of dental therapists than what we've seen with other providers. 93% of Michigan's counties have dentist shortage areas, and that's a federal designation. And so a lot of Michigan is dentally underserved. We have about 1.5 million Michiganders living within those regions. And so dental therapists have to work in underserved communities, such as dentist shortage areas, or if they choose to work in a non-dentist shortage area, then half of their patients have to have public insurance, for example, Medicaid, or be uninsured and low income. So they're just really designed to fill care gaps that exist within our current structure. We also really see dental therapy as a way to help improve diversity within the oral health field. There's a lot of barriers to entering the oral health professions. And in the US, that was really the impetus for adopting dental therapy way back in 2004. Alaska Natives have really poor access to dentists and severely unmet oral health care needs as a result of that. And so they looked out of the country for solutions and recognized that dental therapy, it was being utilized in other countries, many other countries throughout the world, as kind of this community-based model, where members of underserved communities were trained to provide culturally competent care to their communities. And so they really took it upon themselves to close that persistent care gap that they were experiencing. And so we feel like we can replicate this within racial and ethnic minority communities here in Michigan. And importantly, this model can really improve recruitment and retention within dentally underserved communities, which has been an ongoing challenge, to be sure. So I think on top of that, dental therapy, it's a well-paying professional career path. And if we can adhere to that spirit of limiting barriers for folks to enter the profession so that they can access education and licensure, then we can really open doors economically too for those marginalized communities. And so as I mentioned earlier, education standards are high. The programs have to align with specific accreditation standards to make sure graduates are going to provide high quality care to their communities. And we have an opportunity right now in Michigan to think outside the box and really build accessible, high quality community-based education program models right from the beginning. So given all of these opportunities, MPCA has really taken the lead in Michigan to support dental therapy implementation. We're working to raise awareness of the new profession. We're engaged in efforts to support dental therapy education program development in Michigan. Ferris State University is committed to developing our first dental therapy program. So very exciting that we have a university that's going to champion this effort. And then we're also supporting aspiring Michigan dental therapists by connecting them with resources. We've developed the MPCA Dental Therapy Scholarship. So we're accepting applications for that now, and that's going to support students who want to enroll in dental therapy programs out of state. We've got 5 programs that are in operation in the US right now. So some folks are just really eager to get their license as soon as possible and don't want to wait a couple of years until Ferris gets their program off the ground. So they're looking to go out of state, and we'd like to support them. So there are some philanthropic organizations that have been really supportive of dental therapy, and they continue to support these implementation efforts. Pew Charitable Trust, Delta Dental Foundation, Michigan Health Endowment Fund, W.K. Kellogg Foundation, and the National Indian Health Board are all very supportive. And then there are many other entities that have been supportive of this. So lots of energy, lots of wheels turning around dental therapy. I'll put a couple things in the chat box, a couple resources you can visit if you'd like to learn more. And so I think that's it for me. I'll stop talking and kick it over to Ellen Tigger-Hyman from the Michigan Oral Health Coalition to talk a bit about her organization.
Hi, as Misty said, Misty, that's great. I'm not sure how I'm going to follow you. And I think a lot of the things that are happening about dental therapy are a direct result of Misty's hard work. And she's done just amazing things. So I am with the Michigan Oral Health Coalition. I'm the executive director, and our mission is to equitably optimize oral health for all Michiganders. So we have this vision that everyone has the knowledge, support, and care they need to achieve optimal oral health. And so really, this is a problem in Michigan because we have probably less than half of people in Michigan have dental insurance, private dental insurance, and about a quarter of them have Medicaid. And then about a quarter or a little more of people don't have any insurance at all. As you might be aware, Medicare does not have any dental insurance. So we have a lot of people that really have a treatment versus prevention model of care. So they think of, because they don't have the care, they can't afford the care, they go to the dentist when there's a problem, and they aren't able to access the preventative care that might identify a problem when it's very small and be able to take care of it. So we really have a huge need for care in Michigan, and we don't have enough providers. I remember going to a national webinar where somebody on that webinar said, we can't dentist our way out of this oral health care crisis. Like, we need more providers. And for us at the Michigan Oral Health Coalition, we think of dental therapy as one of those providers that can fill the gap and meet the need. And as Misty said, they would specifically work in underserved communities and dental provider shortage areas. So it's really an amazing thing. One of the things that we've been focused on at the Michigan Oral Health Coalition is the correlation between oral health and other conditions. So to have this presentation at the beginning to talk about heart disease and cardiac arrest, that's one of the major correlations is with heart disease and also with diabetes. So if we can improve our state's oral health, we'll improve the population health overall. I just want to mention some of the things that dental therapists can do to help people improve their oral health overall. All of the preventative care, really what it does is eliminates bacteria in the mouth. That causes tooth decay, but also can cause systemic infections. They can measure blood pressure. I just went to the dentist a couple days ago, and they took my blood pressure, which is really helpful to know whether I've had high blood pressure or not. They can perform an oral cancer screening. They can identify known risk factors such as smoking and diet issues. We're really working on ways that they can coordinate with primary care and specialty care so that there can be, the mouth is part of the body. So we can look at that as a person's whole health. And also, I think one of the most important things is educate people on the way to properly care for their teeth. Like, I got advised a couple of days ago that I'm missing my corners of my mouth. So I wouldn't have known that if they hadn't mentioned that to me. So it's really helpful to go to get preventative care. Just to give a little more background on the cost of oral health, if people have tooth extractions, and until April 1st of this year, we had no care under Medicaid for restorative care like root canals and crowns. So a lot of people got extractions, and that's really connected to life-threatening medical conditions, difficulty eating healthy food, and even trouble finding a job, because if you have visible extractions, it's really hard to find a job. The other thing that we've been looking at the Oral Health Coalition is the cost of emergency department care. So people who don't have access to dental care often will wait and wait. If they don't have insurance, they'll wait because they're afraid of the cost, and then they'll go to the emergency room when they're in so much pain or the infection's so bad. And we have in Michigan about 50,000 visits a year to the emergency department for dental infections. Nationally, that's about $2.7 billion a year. And we have 160 million work hours lost each year because of dental infections. So we really see our dental issues in 50 million school hours. So that just kind of gives you a breakdown of like what it looks like nationally in the state for access to oral health care and why the Michigan Oral Health Coalition is supporting dental therapy. I'm going to head it over to our board chair, Jim Milanowski, who's also the president of the Genesee Health Plan. And he's going to talk, I think, a little bit more about Genesee and Flint specific information.
Well, thank you, Ellen. Thank you, Misty. Oral health is a passion of mine and of the health plan. I know on these webinars that we've been having now for the last couple of years, I know Dr. Edwards Johnson and I have talked about the importance of having a medical home where we have a primary doctor, someone that we can trust and go to and ask really hard questions about the pandemic, or should I get this treatment, and one of the things that we've neglected is that a lot of us don't have a dental home. Seeing a dentist regularly and having a relationship so that they can take care of these preventative issues or these issues that come up so they don't get bad, as Ellen talked about, and that in the past it's always been a lot of extractions, just pulling teeth. And I am so happy to see that the state of Michigan and a lot of the efforts of the Michigan Oral Health Coalition in advocating for more benefits for Medicaid recipients. So Ellen mentioned that people can actually now get root canals and crowns and some really deep cleaning as part of their care. Whereas in the past, if their tooth got really bad, it would have to be extracted. And so that's going to be a game changer for a lot of people. So we need to get the word out about that. We also need to get the word out that the rates are better for dentists to see Medicaid recipients. In the past, a lot of dentists would say, no, we're not going to see Medicaid recipients, or we're going to just do it for free, because the reimbursement rate for Medicaid was so low that it really was abysmally low. It was a joke, really. And through efforts of advocacy with our legislature, those rates increase so that now there's going to be a lot more access for Medicaid recipients to be able to go to dentists. Genesee and Flint had a few dentists, and including Hamilton that Misty referenced, that people could go see on a sliding scale, or would see folks that had Medicaid, and not only Genesee County residents and Flint residents, but then everywhere from the state, people would come to here because there was just no access in other parts of the state for that. So this is going to help. And that just started here, as Ellen alluded to, in the last few months. And we have a challenge here to get the word out. And
Jim, can I highlight that a little bit?
Yeah, absolutely.
That's
please
such
do.
an important point, right? I don't think people understand the extent to which there weren't providers of dental care because the reimbursement was so atrocious.
I'm talking about a couple dollars.
And we're talking like $10 versus,
Yeah.
For a $200 procedure. We are
Yes.
really talking about a disparity, which
Yes.
meant that we had dentists who could not keep their lights on if they were taking big portions of Medicaid
Correct.
payments, right? And so you would often just pro bono the procedures, right? It's better to just not take it and try to have a certain amount of slots for which you can provide that care. but that is super limiting. So this change is so groundbreaking, and that it means that you have people who can actually afford to see more people, more Medicaid patients. And I got to tell you, exactly what you said is one of the biggest barriers that I often hear for not seeking medical care. You know, pain and being afraid is often one, but cost and being worried that you can't get the care you need is often the secondary one. So I really appreciate you highlighting that point.
Absolutely. And so the work that the Michigan Oral Health Coalition has been critical. I just want to let the folks know that there's also a local oral health coalition. A number of us get together. I know Nurse T is part of that, and Ellen is part of that, where we talk about these local issues. And we have dentists there, we have safety net providers. And if anybody wants to join that group, I'm sure magically Heatherlyn will put my name in the chat. And please let me know about that, because this is how we can really get the word out, not only to providers, but also to people in our community. A couple other things that I want to talk about real quick with the few minutes that we have. Genesee Health Plan is supported by a healthcare millage in Genesee County. And one of the things that we have been doing now for at least about 10 years is be able to provide seniors and veterans. We talked about veterans earlier and getting disability, but senior and veterans, giving them access to dental care through a Delta Dental insurance. And so it's very critical. I don't know if Nurse T is still out there at the senior center, but I'm wondering if those seniors have dental coverage. If not, we can send one of our staff out there to get that. That's really crucial, because as it was talked about earlier, Medicaid does not pay for it. I'm sorry, Medicare does not pay for it unless you buy a supplemental. And veterans, what's shameful about this is unless that veteran was discharged from the military with a oral health disability, they don't get dental care. And so we have veterans walking around in our community that have very poor teeth because they have not had dental insurance. As Ellen alluded to, there's just so many people that don't have insurance. So in our county, in our community, there is opportunity here for people to get dental coverage. Nurse T, can you ask those people in back of you if they have dental coverage? I might have caught you off guard a little bit.
Oh, there she is.
Hey, Brock, I'll be right back.
Nurse T, we
Okay.
were hoping you could ask your team back there if they have dental coverage.
Do you guys have dental coverage? Does anybody in the room need dental coverage? They said they have dental coverage. What they're concerned about is finding a good dentist. Oh, we do have a couple that don't have dental coverage.
What senior center are you at?
Hasselbring.
Okay, Hasselbring. We'll make sure one of our staff get out there and talk about how they can sign up for that.
Okay, yeah, I'm here every Friday at 11 o'clock. So if they can come while I'm here, we can set it up for them. And
wonderful. Okay, I'll touch base with you on that. I know we just have a minute. I also want to just briefly talk, and it sounds like this is going to be in a future webinar, about the Medicaid unwinding. During the public health emergency of the COVID-19, a lot of people got on Medicaid because they lost their jobs. And normally in the Medicaid world, you will reapply every year to see if you qualify. Are you still in the county that you reside? Is your income the same, etc.? Well, that was frozen for a while during the pandemic. They wanted to make sure people had health care coverage. Well, that process is starting over again. And if people move, they don't have a current address with the state, they don't reply to the invitation to reapply, they could lose their coverage. And so we need to get the word out more that this is starting to happen as of June 1, and people need to be aware of this so that they won't lose their health care coverage. It doesn't do any good if they have access to all this dental care and medical care if they don't have health care insurance. So more to come on this topic, but I know just for time's sake, I need to keep my mouth shut. So
No, Jim, this has been outstanding. There is nothing more exciting than actually in real time connecting a resource with the people who
Yes.
need it. And that just happened, which is amazing. Super happy for your support. Nurse T, we have like 30 seconds if you have one more comment.
I just wanted to say, Jim, if anytime you have any resources or information that can be shared at the senior center, please contact me and I'll make sure that they get the information so that they can be informed.
I will certainly do that. Thank you.
Thank you to everyone who is here. Misty, Ellen, Hillary, Gwen, all of you. Jim, thank you so much. Thank you so much to all of our partners. Don't forget, for those of you who need those continuing education credits, for you community health workers, these are your instructions. We'll see you next week.